This is Jason Williams, DO. This is the Williams Family Medicine channel, helping you to live your best life. Today I have a special guest on the channel with me. This is my son, Nathan Williams. Hey, Nathan. Nathan and I were going to talk about an important topic that we experienced in our family, and it was amplified pain syndrome. Unfortunately, Nathan was the victim of this condition, and it was kind of devastating to our family for quite a time, but he's doing much better now. So it's a success story. To begin with, Nathan seemed to be a kid that experienced what are called growing pains, where you have pain in your legs and it makes it hard to sleep. And it was something where his mom would rub his legs to try to help him before he went to bed at night because it hurt so much. Nathan played some sports. One of them was club soccer. He played this for several years and he really enjoyed it. Unfortunately, he had pain during a significant portion of his playing days. The years between 2016 and 2020 are kind of the years that we're going to discuss today. He started having leg pain, sometimes one leg, sometimes the other, sometimes both. It would be his ankle, his foot, and sometimes his lower leg. It's tricky because his mom is a physical therapist and I'm a physician, so we tried to help him as best we could. And at first we tried physical therapy on our own, but it didn't seem to really help that much. Because he had persistent pain, we decided to get the opinion of a specialist. We were referred by his family doctor to an orthopedic surgeon. The orthopedic surgeon put him in a walking boot after x-ray, felt he likely had what's called calcaneal apophysitis, which is inflammation where your growth plates are. He tried the walking boot for a while, and then after he got out of the walking boot, still was having pain. On a subsequent visit to the orthopedic surgeon, he was placed in a cast. And this was to be for about a month and then to be reassessed. During that time, we had to go out of town on a trip to California. And during that trip, we went to Disneyland and Universal Studios. So the cast really came in handy as we got to go to the front of the line on all the rides and were able to move through the park really quickly. So that was cool, but it wasn't cool to push him around in a wheelchair, and it wasn't cool for him to be using crutches. After the cast, Nathan had persistent pain, and this was very frustrating. We did have imaging and lab work. None of the testing revealed any obvious specific causes for his pain. Because Nathan had persistent pain, he was referred to a pediatric rheumatologist. When we went to the rheumatologist, we were given the working diagnosis of enthesitis, which just means severe pain at the enthesis, which is the interface between the joint and the bone. Nathan was started on heavy-hitting anti-inflammatory medications because regular anti-inflammatories did not seem to work. He was started on methotrexate and sulfasalazine. After a trial of these medications, Nathan still was having pain, and his rheumatologist recommended Humira injections. We were not real happy with Nathan having to be on immunosuppressive medications, but we wanted his pain to be resolved as well, so this was very tricky for us. During the course of this treatment, we were able to get a second opinion from a different rheumatologist who agreed with the primary rheumatologist diagnosis. No changes were made at that time. Unfortunately, Nathan continued to have pain. This pain seemed to be getting worse and was affecting his function quite a bit. I want Nathan to talk about this a little bit, but I can tell you what we witnessed as a family. We witnessed him to have increasing pain. We had to get him up a couple hours early in the morning to try to get him around for school because it didn't seem like he could get going very easily. He was having so much pain that it was hard for him to walk, and he was using crutches to help him walk to take the pain away. But Nathan, go ahead, tell us a little bit more about what that was like for you.
I just missed out on a lot of things. I feel like I missed out on middle school years because I wasn't able to do much, because I was in crutches and everything, and missed out on a lot of school. I got behind in schoolwork, had to go in after and before school to make up work. And then, I was just absent from school a lot, so,
Yeah, frustrating. So Nathan is a good student, and it was important to him to do well in school, so this was stressful for him and for us. We didn't know what to do at that point. I did speak with one of my friends who knew about stem cell And at this point, we were willing to consider that, as that seems to help autoimmune or inflammatory type conditions. Our working diagnosis at the time was enthesitis, which is an inflammatory condition. Nathan and I were able to make the trip to Panama to do a stem cell infusion treatment. What this involved was an IV placed in his arm and stem cells being infused once daily for about 5 days. During the time we were in Panama, as he was receiving the infusions, his pain did remarkably improve, but shortly after we returned home from Panama, unfortunately, his pain quickly came back to the same level it was before. This was an expensive trip and an expensive treatment, but as a parent, you're willing to do whatever it takes to try to help your kids, and so that's why we tried that. It was time to see Nathan's rheumatologist again. And after Nathan had been on the immunosuppressive medications and Humira and received the stem cell infusions, no improvement, still suffering in pain, still using crutches, still missing school, sometimes multiple times per week. We were referred then to a pediatric pain specialist in Kansas City. During that visit, that specialist confirmed that Nathan had amplified pain syndrome. She was very confident in the diagnosis and told us at great length what it was and how to treat it. This gave us some hope, since we had really not had much hope so far and only had seen him to decline with the treatment we'd already tried. On the first visit with the rheumatologist for amplified pain syndrome, she indicated what the treatment would be and talked to us about what the pain was. As far as treating this, part of the treatment is to push through the pain and to realize that the pain is not dangerous. And this is the hard part. On that visit, the rheumatologist told Nathan, said, that's it, no more crutches. And he never used crutches after that day. They have a program in Kansas City called the RAPS program, stands for Rehabilitation in Amplified Pain Syndrome. We applied for this, and Nathan was approved for it in 2020 and was able to attend that in the summer. So now he has had this condition from 2016 to 2020. The RAPS program was an intensive program 5 days a week for about a month, and it involved intense exercise. It involves psychology, reframing of your condition, and then emphasize creativity. I want Nathan to talk about the RAPS program a little bit from his own perspective, and maybe that will kind of let you know a little bit about what the treatment is like. So go ahead, Nathan.
Yeah. The program helped me realize you can do a lot more than you think you can do, because I was doing like extreme exercise like every day for a whole week without much breaks other than just the evenings, and on the weekends when I drove back home to Andover. So yeah.
So what kind of exercise did they have you do?
Specialized exercises, like to focus on areas that hurt you. So for me, with joint pain, like if your knees hurt, they might make you do lunges. Or if your toes hurt, push-ups, just constant bending the toes. Mm-hmm. Or just walking upstairs. Yeah, all kinds of stuff, all kinds of specialized exercises that the therapists think of.
Mm-hmm. So basically push through the areas that are hurting you. Yeah. Okay. Nathan completed the RAPS program. He had a small bump in the road. He had a kidney stone during the course of this, probably from getting dehydrated from the excessive sweating from the exercise, but he didn't let it deter him, and he did well. He was doing much better after the program finished. Part of the treatment is to continue after the RAPS program, which is to do regular exercise, push through. It emphasizes creativity and just positive reframing of your condition. And for success, he has to continue that, and it's up to him at this point. But he has some really good tools to help him. The RAPS program was a great way to aggressively attack amplified pain syndrome. It doesn't have to be treated in that manner. Some patients can do it on their own without going through that specialized program. Amplified pain is very similar to complex pain syndrome or reflex sympathetic dystrophy, and these are things that are often described in kids and adults as well. The pathophysiology of amplified pain syndrome is thought to be related to blood vessel problems. It's a weird spinal short circuit where the nerves that go to the blood vessels seem to cause vasoconstriction of the blood vessels or narrowing of the blood vessels. When the blood vessel is narrowed, then the tissue doesn't get enough blood flow. When that happens, you get a buildup of lactic acid, and lactic acid causes increased pain. And when you have that pain signal, it also short circuits across and once again reinforces the pain cycle. Because of this reinforcing circular pain cycle, patients have pain. It's weird because some people notice if you look at the skin of people that have amplified pain syndrome, they'll start to have purple, red, discoloration, even sometimes numbness and tingling in the extremities involved. So that's one of the classic features of amplified pain syndrome. One of the key takeaways I want patients to know about, and just to say this from the beginning, this video is long overdue because I think people need to know that this can be easily confused with other problems. The unfortunate thing that can happen to some patients is patients can be labeled, or parents can be labeled, as faking it, or Munchausen syndrome, or some type of psychiatric diagnosis. Even though the patient has a true problem, it's hard to objectively see the problem by testing. It's very unfortunate. I heard of a case of a kid that had Ehlers-Danlos syndrome, which is a hypermobility syndrome that can result in severe pain, sometimes autonomic problems where they have blood vessel problems, increased passing out, these type of things. This patient had been through multiple doctors, multiple workups, and eventually was labeled as having conversion disorder. And conversion disorder is a psychiatric diagnosis where it's basically that the patient is faking it. This patient was desperate, this teenage girl, and she actually tried to commit suicide because she had no help. The doctors had pulled off all treatments, and they basically told her that she was faking it. She was unsuccessful in committing suicide and finally did find a specialist that could treat her Ehlers-Danlos syndrome and finally did improve. But this is just a warning to healthcare providers that you need to be careful about labeling patients with these kind of conditions. Amplified pain syndrome can be very serious, and we've experienced it ourselves. I just wanted to share this with my patients. So if they themselves, their families, or any of their loved ones are having problems, they can just kind of remember you can dig deeper. Even if the data doesn't support what's going on, keep looking, keep getting help, keep getting consult visits, and don't give up hope. So Nathan is a success story, and his story is not over yet, so he'll keep going, but we just wanted to share this with you today. We think it's important. This is Jason Williams, DO. This is the Williams Family Medicine Channel, helping you to live your best life. Nathan, thanks for being here with me. Thanks for carrying me on the video. Thanks, guys. Signing off.